Hi students, I'm going to go through the poisoning adverse effects section of your assignment. Um, I really do like this section because to me, once you get to know the rules, it's cut and dry. So let's look at case study number one. We have a patient who comes into the emergency department, nausea, vomiting, weakness. They're on oxycodone for the pain. They also have pancreatic cancer. Um, in their extreme pain, they decide to double their dose. Okay, this didn't work, so at that point, they drank whiskey. So then they called 911. They were admitted, treated. They were dehydrated. They had IVs, and pain medication was adjusted. So a couple of different things here. When you have a prescribed medication with the oxycodone, um, and you double the medication, this is poisoning automatically. Whenever you have a prescribed medication and you mix it with alcohol, this is also poisoning. A couple of different things that you want to make sure you remember. When you have poisoning, the T codes always come first. And then you have your signs and symptoms or any other diagnosis codes that will be secondary codes. So with this, just as I stated, this is poisoning. They mixed a drug with alcohol. Plus, again, you could go with that they doubled their dose. They didn't take it correctly. So that is not an adverse effect. So our first code here is our T code for the poisoning. This is for the oxycodone. And one thing students always seem to tend to forget is that you need to, any drug in the system, you need to code them both. And make sure that you go, when you go to your T codes for, you just pull it up, for your drugs, make sure, let's pull this over, that you are in the poison accidental for this one, unintentional. They were just trying to make the pain go away. No, that's not the right drug, but just so you're in the right column. Okay, so then we have two drugs here. Um, A is for the initial encounter. This is the first time. What are the additional? Okay, I did state if we, right here, I did have a student ask about, why are we coding the additional codes? Well, per ICD-10 guidelines, manifestations of the poisoning are coded as additional. So nausea, vomiting, weakness, dehydration, we're going to code too because they were treated with IV infusion. Cancer is also coded because it's the underlying condition which caused this patient to take the extra medication. And then when that didn't work, they took it with the whiskey with the alcohol. So we have four additional diagnoses as stated. Are there any procedure codes? No, we are not doing any codable procedures. Remember the UHDDS requirements. Administration of medication, fluids for the dehydration does not meet the criteria for significant. Okay, let's venture on to case study 2. Patient admitted for renal failure, acute. Again, they were taking medication for pneumonia since January. They're experiencing some edema, decreased urine output. Labs were drawn. Physician admitted the patient for IV fluids. Gentamicin was stopped per history. They did do a chest x-ray. It revealed adequate clearing of the patient's pneumonia. Patient's renal function returned to normal. Conditions that are being treated with this hospital stay include the hernia and seizure disorder. Okay, so my final diagnosis is acute renal failure due to the gentamicin. So we also have history of pneumonia, hernia, and seizure disorder. This is an adverse effect. They took everything correctly that was prescribed. Okay, so keep that in mind. So that is why we have an adverse effect. Now, when you have an adverse effect, you are going to code why the patient came in. Okay, this patient came in because they had the, right here, acute renal failure. So that is my principal diagnosis. It is not the T code. This is an adverse effect. With an adverse effect, you code whatever is wrong with the patient or brought the patient in for the admission or to the emergency room. And then you have the T code secondary. So we'll get to that momentarily. So is the pneumonia coded as active? No, it's a history of, because again, it's clearing. All right, so our additional codes, we have our T code. Okay, so for our documented drug, we have the K code for our hernia, the G code for the seizure, Z87, now this is for the history of pneumonia. J1 5.1 is not assigned because it is not active, it's not current. So let me pull up the book here real quick. So when you do look at this, make sure for the T code, you go to right here, hold up here, make sure you go, in the adverse effect column. And then you're going to add the A for initial, the seventh character. Do not forget that. Okay, so the last one here, it should be no. It looks like it's pointing to yes, but no. There's no reportable ICD-10 PCS codes to be signed. Once again, treatment with the medication, IV fluids is not significant per the UHDDS. If anybody has a question on this section or you're a little unsure where to look, please, drop me a note in my inbox. I'd be happy to help you or walk you through anything if you struggled at all on this assignment. All right, thank you. Everybody have a good day or night.